Okay, let's go on to some questions. H2D2, these are not the drugs you're looking for. Now, if you don't get the joke, you probably have a social life. Let's move on to the question. The following statements pertain to H2 blockers. Pick the false statement. A, the H2 blockers are more potent and more effective than the antacids. B, cimetidine is the most tolerated and widely used of the H2 blockers. C, irreversibly inactivate the hydrogen-potassium ATPase pump. D, cimetidine has anti-androgenic actions at high doses. And E, inhibits absorption of drugs like ketoconazole. So pick the false statement. Good, you chose C. Remember that H2 blockers do not irreversibly inactivate the hydrogen-potassium ATPase pump. That distinction lies with the proton pump inhibitors. Let's move on to another question. An 80-year-old male with chronic constipation presents with severe gastroesophageal reflux after a large turkey dinner. The best choice for acute treatment in this individual is aluminum hydroxide, magnesium oxide, calcium carbonate, sodium bicarbonate, or metoclopramide. Good, you chose magnesium oxide. So when you're looking at these agents, remember that aluminum oxide, which is also known as Maalox, can be constipating. This guy already has constipation, so maybe it's not a great choice. Calcium carbonate and sodium bicarb are weaker antacids. Calcium carbonate is found in Tums, for example, and sodium bicarb is found in a lot of those effervescent tablets that you buy over the counter. Metoclopramide is a promotility agent but not an effective antacid, so it's not treating both problems. The answer here is going to be B, magnesium oxide. It's also called milk of magnesia. It has laxative effects, anti-acid effects, and is also quite soothing on the elderly bowel. All right, let's look at another case here. A 55-year-old male has diabetic enteropathy with poor bowel function. He was placed on some domperidone. The following statements are true except, so pick the false statement. A, metoclopramide and domperidone are both D2 blockers. B, domperidone crosses the blood-brain barrier. C, metoclopramide and domperidone may be used in the gastroparesis of neurologic origin. And D, metoclopramide may cause Parkinsonian symptoms. Fabulous, you picked B. Domperidone crosses the blood-brain barrier. Remember that this is incorrect. Domperidone does not cross the blood-brain barrier. Metoclopramide crosses the blood-brain barrier and can actually act as an antiemetic. Domperidone doesn't.